breaking news, strep, also known as Streptococcus pyogenes, has ravaged the woodlands and is on the hunt for you. If you show any of the following symptoms, check in with your local doctor.
Recently, there have been high-risk groups for strep throat. Streptococcus pyogenes can take up residence in the body. In the membranes of the brain, it can cause bacterial meningitis. In the ear, it can cause otitis, or an ear infection. While in the sinuses, it can cause sinusitis. In the throat or pharynx, it can cause pharyngitis, known as strep throat, which is the most common. In skin, it can cause several conditions, including impetigo or erysipelas, which bring on blister-like lesions on the skin. Anyone of any age is susceptible to strep throat, and despite common conception, strep throat can occur not only in the winter, but all year long. Those most likely to get strep are usually between the ages of 5 and 15. The people that are most at risk of getting strep throat are those that have strep throat in the past and those that have had recurrent episodes and still have their tonsils. As mentioned above, you can get strep throat during any time of the year, but are more likely to be infected in late fall, winter, and early spring. Anyone that is in close contact with other people is more likely to be infected with strep throat because the disease simply is very contagious and thrives in schools, workplaces, daycares, as well as between family members. Recently, studies have come up about strep throat. Approximately 40% to 60% of cases of pharyngitis are caused by a virus. About 15% are associated with streptococcus infection, or strep throat. In the United States, children typically average 5 sore throats per year and streptococcus infection every 4 years. Adults typically experience 2 sore throats per year and streptococcus infection approximately every 8 years. The incidence worldwide is higher, possibly because of resistance to antibiotics caused by overprescription. Sore throat is more prevalent in winter when respiratory disease incidence is highest. The incidence of pharyngitis and strep throat is highest in children between the ages of 5 and 18. Sore throat is rare in children younger than 3 years old. The statistics on prevalence vary from source to source. However, the CDC reports that there were approximately 9,400 cases of invasive group A streptococcus, which is strep throat, reported in 1999, resulting in 1,500 deaths. And there are over 1 million cases of strep throat and impetigo reported yearly within the United States. Also, in the United States, 15 to 36% of 7.3 million outpatient visits each year among children were due to Streptococcus pyogenes. Strep throat is also more common in the northern area of the United States. However, it is seen throughout the nation as well as the world.
Streptococcus pyogenes attacks certain cells in the mouth, such as the inner gums and the tonsils, leaving much discomfort. Without treatment, it can lead to severe symptoms and even infection. Strep is usually transmitted through the sharing of liquids, coughing, or sneezing, and kissing.
A developing story has come out about the life cycle of our pathogen. The incubation period of illness varies depending on the infection and can be anywhere from a few hours to weeks, months, or years. The typical incubation period for strep throat is 2 to 5 days, with the average being 3 days. This means that from the time you are exposed to the illness to the time you start having symptoms will be about 3 days. The natural habitats of the symptoms are found in the pharynx, skin, and or rectum. The physical structure is swollen, whitish spots on the gums of the mouth and or tonsils. Please be aware if you have this.
Don't worry, there's a treatment for strep throat. The treatment for strep throat is generally quite simple, and one treatment course is usually effective. Antibiotic treatment, which is what it's called for, and the antibiotics will begin to reduce the symptoms as well as the transition rates within 24 hours. The normal course of treatment is roughly 10 days of penicillin orally, or one single injection of penicillin. When antibiotics are taken, patients will begin to feel better in just 4 days and will likely be able to return to their normal day-to-day activities. While patients may feel better, it is important to always take your medication fully. Do not stop short. Until antibiotics begin to work, patients can treat strep throat by sipping warm liquids, ingesting plenty of liquids, taking pain-relieving medications such as ibuprofen, ibuprofen. Preventing strep is very difficult because many of the people that are spreading it don't know that they actually have it. That's why it's important to go to your doctor and seek treatment or diagnosis. The best idea to prevent, though, is to avoid using the same glass or straw as other people and also avoid close contact with others. Please, do not let it spread. Visit your doctor